the Dutch flight attendant of the flight which had reported symptoms and was tested has been tested negative for hantavirus that we received this morning from the Dutch IHR focal point for the international health regulations according to these regulations. So that's very good news. And that leads to the contact tracing that you're saying, that you asked about. So she was in close contact apparently with that woman who then later collapsed and died in Johannesburg. Yet she's apparently not infected with the hantavirus. So that is, in many directions, good news. The tracing worked. The fact that she presented herself with symptoms worked, and the testing shows that she's not infected. As to my knowledge now, the two couples, one where unfortunately both of them died, the one on ship and the other one in Johannesburg, and then the other couple with one infected is the one here in Switzerland now, where the wife, although she was on the whole journey together to this point, has not presented any symptoms and is self-isolating as we hear. So that shows you again, luckily, apparently the virus is not that contagious that it easily jumps from person to person. So the risk for the general population is low. That is and remains one of the most important messages. And with these cases we just discussed, it shows you how close contact has to be, and yet not no forward transmission. Under any normal circumstances, a normal handling of a person should not present any danger to the individual or to the people around. And definitely, if you're a bit further away, the risk is minimal, if not zero. So for the general population on an island in any of the countries, we don't say zero, but it's an absolutely minimal risk. As we said now multiple times, this is not COVID. I know, and we all know, that we have COVID fresh in our minds still. And that's the first connection everybody made, hence the international attention to these cases. Hantaviruses are around since about 30 years that we know about them. We have a couple of thousand cases each year globally. If you recall the press release by the Swiss authorities, they say they have about between 0 and 6 cases they deal with a year. So this shows you the magnitude of this virus, and it's a very little, small magnitude. So the hantavirus, this is not new. The Andes virus is also known, which is the one that the only one we know of that spreads human to human, but only through close contact. And again, close contact. It's hantavirus brings pulmonary infections, lung disease, respiratory problems. So that means you're coughing, you're maybe sneezing with fever, but especially the coughing. And that would be something, if that goes directly in your counterpart's face or whatever, body fluids, that would be a risk factor, obviously. But I need to stress again and again, even those who have been sharing cabins don't seem to be both infected in some cases. So the risk remains absolutely low. This is not a new COVID. I can't give you an exact centimeter measurement, but it has to be with you know anything you cough out. If you share saliva, that might be something. Like spitting would also be a problem. But apart from that, again, let's not forget, from couples who were close or are close, from a flight attendant who handled the sick woman who just shortly after died and was feeling extremely unwell, we get negative test results. That should convince nearly everybody now that this is a dangerous virus, but only to the person who's really infected. And it's the risk to the general population remains absolutely low. I don't know exactly when the ship is about to arrive. That's definitely between the operator and receiving the host country. But what we know is that the ship had been waiting for two medical doctors from the Netherlands to arrive and board the ship so that they would go with the ship together with our WHO expert on board. These three would accompany the ship all the way to the next port. If that was the reason to delay, I can't tell you, but that they had been waiting for these two medical doctors, hence could only depart then.